Welcome to the Boomers, Bucks and Bling podcast, where we turn retirement planning into a bit of a thrill ride. I'm your host, Carl Spiteri, and each week we'll dive into everything from reverse mortgages and staying put in style to Medicare, Social Security, and home safety. But wait, there's more. We're not just going to talk all about money and business. We're going to add some sparkle, some bling, as we chat with travel pros, party planners, and a lot of different topics that's going to help you make the most of your golden years. So grab a cup of tea or whatever it is you want to drink, get comfy, and let's make retirement planning an adventure of a lifetime. Hi, welcome to this edition of Boomers, Bucks and Bling. Today we have a very special guest, Keith, who's been with us before, who's going to talk about the new HR 1 bill, the Big Beautiful Bill Act that was just passed by Congress and signed by the president. And it's going to bring some changes to Medicare. So we thought we'd have Keith on and talk about it. Keith, welcome.
Hi, Greg. Sorry. Hi, Carl. How are you today?
I'm well.
Crazy morning.
I'm well.
Yeah. This is a
what are
good
your
time
thoughts?
to talk about the big, beautiful bill, if you will. See what I can do to answer the questions on the healthcare side or Medicare side, Medicaid side, if you will.
Yeah. Tell us a little bit, what's your initial perception of it?
Well, I think initially, it was kind of mysterious. I did download it, and it's a huge 2,000-page bill, and I tried to find.
And again, to our audience, not to interrupt you here, Keith, but to our audience, we're only talking about what pertains to Medicare here. We're not
Correct.
We're not talking about anything else.
No, my specialty is Medicare and Medicare supplement, Medicaid, etc., Medi-Cal in California, etc. So what I found out is, there are some big deductions within the bill, which aren't going to happen right away. It's going to happen within the next 2 years and 2027, 2028. We're going to see these deductions in reimbursements, etc., that they've pushed out to the physicians, hospitals, which eventually gets trickled down to the client, the insurer. And in these cases, we're talking about almost $800 billion that's being taken out of Medicaid in general. And the trickle-down effect is it's going to cost more money for people to go get insurance. Insurance rates will go up, and people will not be able to get covered for things. They'll take policies like Medicare Advantage policies and reduce the options in them. Take out the dental, take out the vision, allow you less visits to the doctor without a copay, or increase your amounts for your diagnostic tests like CT or MR. That's an out-of-pocket cost, or increase your maximum out-of-pocket, which puts doctors at a disadvantage because if they don't get reimbursed, they'll look to remove themselves and their contracts from these programs and find better ones that they can service people. The people that are going to hit the worst will probably be those in the rural areas and those that have what's called dual needs. There's programs called dual DSNP, as in dual special need programs. That means someone who's got Medicare and Medicaid. If that gap is lost in terms of the monies that go to Medicaid, a lot of these people will lose the services they receive now. And that means things like, you could be less than 65 and be disabled and have a number of different issues. Kids that have certain diseases, disabilities, less money available for them to go to the doctor and get these services. You can lose simple things like, a wheelchair or one of those automated chairs to drive around in because the money isn't there for these plans. So I think that's the big part of, what's on the big, beautiful bill is that it's not going to happen right away, but it's going to happen over time, and it's going to be over the next couple of years. Of course, it's not going to happen this year, but I did read through it. It's going to come out probably in 27 and 28, where you're going to see these changes to the current Medicare status, which gives the carriers time to refine their current, insurance. They're going to be looking at their insurance plans and how those plans affect the zip codes that they're in and where they will pull out of. So that's also a thing too, is Medicare, especially Medicare Advantage plans. It is predicated on zip codes because not every plan is in every zip code. And what happens is that when these carriers pull out, that leaves one or two carriers in these remote places where people have the most issues, it seems, and they can't get the coverage they need. So either they have to travel out of their zone, out of their zip code range to get coverage. Some of them don't have cars to drive. There aren't that many plans that still have, I'll call it the Uber services. They have transportation on a lot of these plans. I haven't seen them on some of the plans. They've pushed those things out. So it's making it more difficult for people to get to the doctor. Local
Okay.
communities, they'll have buses and whatnot, but you have to be on that schedule.
So the fact that it's being phased uh, in my opinion, I mean, cuts are cuts. Nobody likes cuts. Um, I think it was Ronald Reagan that said, when your neighbor loses a job, it's a recession. When you lose your job, it's a depression, right?
Hmm.
So with these cuts, they're being phased in. So the insurers and the physicians and the health centers have time to maybe adjust their offerings and how they're going to approach this to not leave a big part of the population uninsured.
Exactly. I
So let's
think
talk a little bit about that, because I don't believe in the chicken little philosophy, right? I don't. My intent here is never to scare people, right? Let's give
no.
them solutions, and let's talk about the solutions.
Well, we had let's be honest, the bill came out and there were all these cuts, there's all these changes to the bill. I don't know all the change, but let's just stick with Medicare.
Yeah,
And
2,000 pages, right? Who
right,
knows,
but you
right?
look at it and it said Medicaid is going to be cut by $800 billion. And that's a lot of money. That's a lot of money. So when you look at that, okay, we had a lot of news feeds saying, "Oh my God, this is what's happening. They're going to cut. They're going to lose." And I had to dig a little deeper and say, "Well, how is this going to affect all these millions of people? Because it's not 10 people; it's millions of people across the U.S."
Right.
And it not only affects the Medicaid people, it affects the Medicare people. But they've built it in a way that, okay, it's over time. We'll start to put in some of these reductions. Don't know if they'll last. Don't know if they'll stick or they'll be the great for the economy, but we're going to have to watch and see. We're going to have to see what the carriers decide they want to do. One of the largest carriers is United Healthcare. They carry, the lion's share. I think they own 23% of the market. So they'll have to change, their reimbursements. They'll have to change the way they do things if they don't get reimbursed, because these companies all get reimbursed by the federal government. All these plans on the Medicare Advantage side get reimbursement from the federal government. So if Medicaid cuts back, eventually you're going to see some cuts in Medicare as well. And what happens then, hospitals will start to they're going to have to, re-strategize their budgets as well, because they plan on getting these kinds of reimbursements to pay for certain procedures within the hospital. And if they don't get it, it hits the emergency rooms, it hits the clinics. So with the window of 2 years, I think it gives us time to take a look at. And I know of some companies and not-for-profits that are looking at ways to fill that gap, because they have to look at how they still can service the people in their areas.
Mhm.
So
I was speaking to a physician just the other day who was telling me that the hospitals and actually even his office are looking to like eliminate positions such as the front desk person, where now you're registering when you walk into the office with a kiosk, and even taking blood pressure and different things with the introduction of AI into the medical community, there is some cost cutting that go on within the facilities themselves. What are your thoughts there?
yeah, it's inevitable, because over time, I mean, Medicare, not just because of the bill, things have changed for these services. They have been cutting back, which earlier we had another podcast and talked about, how doctors change plans because they're not being reimbursed. So for them, it's particularly it's unaffordable for them to stay in a plan and service these clients that they don't get enough reimbursement for. So it's the same thing, in the hospital sector, they have to cut back. They have to look at other ways to increase the revenue to stay profitable, and also to
Mhm.
draw, the right, population of employees, people that are good at what they do, not just the physicians, but nurses, technologists that will work at these hospitals. You have to have labs working, labs stay open sometimes in some places, 24/7. Radiology places will stay open 24/7. You have to
Mhm.
have staff to do that. You have to have licensing. Can the hospital afford to pay those people? And those costs have all went up, in terms of what it costs per hour to you know, pay a radiology technology specialist who does MRI or CT, or he just does X-ray. There's still cost involved. Plus the
Hmm.
physician that reads them and how much that is, the technical fee, the reading fee. So they all have to, as an entire group, the healthcare initiative is in a sense has to look at how this is going to affect them, because in every hospital, every walk of life, there is always a Medicaid or Medicare patient that's walking into one of those hospitals. And that question is, how do we service this persons and still keep afloat, keep a budget afloat? Some do better than others in terms of hospital, what they have in budgets, but that's something that you have to consider. Not buying new equipment for instead of next year, it's 3 years out. They all have budgets for large capital equipment at times,
Right.
multi-million dollars in building a room. I think the cost now building a hospital is, it goes by room. I think it's up to $1.5 million per room. So when you build a 300 bed, or sorry, I should say bed hospital, a 300 bed hospital, do the math. That's $450 million just to build the hospital. What else does it cost? It's in the billions now to build a hospital. That's just the room. Think about all the other
Amazing.
things. So it's, it's cost effective, and you put bonds out, you try to find ways to pay it. It's it's very expensive.
Yeah. Well, I guess there's a cost of living longer, huh? When we were all, it was very rare for somebody to live into their 70s.
Right.
It
Well, they
was
didn't
like,
plan that, right? Because now Social Security
yeah,
is saying, I read recently that it's going to start to, what's the word they use? Be insolvent. By 2032, they won't have the same funding available. So you're going to be stuck with getting 85% of your Social Security payment by 2032. Well, if they privatize it, what happens to all that money that was in there for all the people earlier? And if they don't privatize it, then maybe they have to increase the amount that's coming out of the general public in their
yeah,
FICA funds to help pay for that. Because we all pay for, as I said in the previous podcast, when you get Medicare, Part A is free, and it's not free. It's actually money's taken out through your FICA every paycheck until you reach a certain amount. And then at the end, you've already paid for that. So when you turn 65, it's the one piece you don't have to pay for. So maybe within Social Security, they have to increase those budgets. I don't know.
yeah. I guess thank goodness for the Gen Z generation, right?
Yeah.
Because they're the largest generation since the baby boomers, so that's a good thing.
And hopefully they can cover the cost, because
Exactly.
getting it's getting out of hand.
We'll do
Bills
the
like this.
political thing, kick the
Yeah.
can down the road, right?
Yeah. And bills like this, we've seen them in the past, in history, not maybe to this amount, because money is, we're seeing talking about trillions versus, I guess when I was a kid, it was like, wow, millions. Now millions mean nothing. It's billions. And now we're talking trillions.
Yeah,
So when you
yeah.
think about $1 trillion to run some companies are at $1 trillion, market cap, and other companies, in the multi-billions, but we never had that years ago. So, and now it's hit us in healthcare in the last several years. It's like a 3 trillion or more deficit.
Yeah, it's a tough one. Cuts have to be made, I guess, and hopefully the people in politics always keep the little guy in mind, and when they pass these bills, they find other ways so everybody succeeds. And I think that's the goal. I think
Yeah.
both parties would have that same goal. They just take different approaches to it, and well, time will tell whether the big beautiful bill is indeed beautiful, or if there's now the big ugly bill that the other side passes that
Yeah.
makes it more beautiful. I mean, who knows where this stuff goes,
We
right?
don't.
We can
We
only
don't.
we can
And
only
again,
speak to experts about what we know and how we can help them, and kind of leave the all that other stuff that's
yeah,
going to happen. We have no control over it.
I think you said earlier, it's the old, the sky is falling. I think there's nothing we can do about it in terms of we can't change the bill. That's not our job. But what we can look at, in the industry of Medicare is, okay, how does that affect how I work? I mean, what can I do that's going to be, better or more reactive? Because people are going to still need Medicare. It's what
Mhm.
plans are available. It's the one thing. And what plans will be taken out of the mix because carriers decide they can't afford this type of service. And and eventually, those things get phased out, and at one point they get phased back in. Years ago, there used to be there in a lot of these Medicare Advantage plans, they had what was called a debit card. And you as a a patient would get this debit card. You sign up for the insured, you sign up in these plans, we have a debit card that's worth, I mean, some of them are $2,200 a year. You would get money put on your card every month to buy food, groceries, pay your electric bill, pay whatever ancillary services you need, or rent for that matter. They've phased that out over the past, year or so. You don't see them anymore. They don't advertise it. I mean, that was a big thing back in a couple of years ago. You have these big, large boiler room Medicare places that are, oh, get your your debit card, and all the people would call you and they say, I don't want to change my insurance. I just want that debit card. And I'd have to explain to them it doesn't work that way. You have to change your plan because it's a Medicare Advantage plan. You only can get it if you sign up for this plan. And that may not mean you get your doctor, and they get mad at me because I can sign them up. I'm like, I'll sign you up, but it doesn't, you just can't get the debit card. I'm not the bank, it's,
Yeah.
and so
Yeah, you're
that
just
ends up,
following the rules. You're not making them, right?
yeah. And, they get this whole marketing thing going and, after a while, I think it got out of hand. And then I think they realized that the carriers couldn't keep doing this plan, just wasn't affordable. And I guess government was going to keep paying them this money for them to, have these kinds of offsets. Like transportation used to be, some of the carriers would have up to 60 one-way trips to the hospital or the doctor per se from your home. So you can call like an Uber and that will be paid for. And others will do less. They either do 12 trips round trip or 25. And I've seen it phased out. I don't see that anymore. So slowly they phase these things out. The gym membership could be phased out next. I don't know. But just to keep
So,
it.
so in reality, even though the bill that just passed changes a lot of things, it's been evolving for as long as time, essentially, right? There's always been an so even though this is a change, this is probably a big change. It's not the first change. It's not the only change. Change happens, and your job, my job, is to inform people that change is coming, and then you, being a Medicare specialist, is to help people prepare for the
Sure.
changes.
I think a lot of the bill comes from talking about fraud and abuse. It's some of the major words they used a lot. And you have to figure that piece out. It's been going on in this industry. You hear about these cases where, doctors are billing, over 25 hours a day, or they're having billing for these knee brace devices for all these patients that they don't have. And it's true, they find these things. They do find them, but they don't have enough of a staff that's on fraud and abuse. And I think that's a big part of why this bill is in place, is to remove the fraud and abuse, which we hear about, but we don't see like that it's actually helping, that they've cut this one out. It's like a hydra, right? Cut one, another head grows. So
Yeah, exactly.
and maybe this is the way that it's cut down so bare. I don't know. Maybe it's going to be cut so bare at one point that they can start to put things back in and put more regulation in place. Maybe.
Well, they got a real big voting block to take care of, and whichever party's in power seems to want to continue to be in power. So if it's completely broken, somebody's going to fix it.
Yeah.
It's kind of always my opinion.
However you cut it, you're always going to have people that are under the radar, don't make enough money. The poverty level line has gone up in terms of what that is today. For example, you can get Medicaid, Medi-Cal, but you have to stay under an income. I think it's now $16.69 a month. And you go $1 over that, you lose your Medicaid or Medi-Cal, which changes your whole plan. So then you lose a lot of benefits on the Medicaid side. Like in California, it's the Medi-Cal. So, it's that number's creeped up a little bit, but not enough to give people a little bit of a breathing room.
Keep up with inflation, yeah.
Yeah, I mean, some people I've talked to, trying to put plans, they're lucky they have enough at the end of the month for rent or food. And it's very disparaging to hear that, it's not just one or two people. It's you're trying to help people, and it's hard because you're limited by the plan and they're limited by income.
If you're one of those people that are living month to month like that, and you do own a home, looking at a reverse mortgage is a possible help. I don't want to say solution because everything has costs and positives and negatives to it, but it could possibly help you. So I just thought I'd throw that in because I don't think anybody should be living that tight, especially if they have equity in their home.
I mean, I think it's very possible that it can help. And I think it's maybe in your realm of work, it's just that understanding what the reverse mortgage really means. I think sometimes people see it as, I'm taking this money out. Why am I doing this?
I'm giving away my house. So the government's
Yeah,
going to take
and
my
I don't think
house or
that
something
it's
like
all
that. And
right. I don't think it's all understood. And you talked to me, you told me the other day, we were talking about it. I get a better feeling of it. And I know some people that have reverse mortgages, but I never, I wasn't understanding what the best avenue is. And I think you're right. If
Mhm.
they have a house and they can understand that they won't lose their house, that this can help them. Because in times of you can't lose your house and you lose your health at the same time, it's you're going to go downhill real fast.
Yeah, yeah.
There's no, safety net under that. So it's a good
Well,
point.
Keith, I want to thank you for your time once again. We always enjoy having you as a guest. And
Thank
well, how
you.
do people get a hold of you? Because you're a wealth of just a whole bunch of information in that head of yours. So how do people get a hold of that information?
Well, you can always call me or text me at 415-971-0384, or email is kbetko@icloud.com.
Okay,
My
give us your
number
phone number one
again,
more time.
415-971-0384.
Keith, thank you very much again. We really appreciate your time.
You're welcome, Carl, anytime.
Thanks for tuning in to this episode of Boomers, Bucks and Bling. We hope we've managed to mix a little enlightenment along with fun. If you enjoyed our conversation, don't forget to hit the subscribe button so you'll never miss out. And if you got a moment, drop us a review. It helps spread the word and keeps us motivated to continue. Got burning questions? Hot topics you want us to dive into? Let us know on our website or social media. Until next time, Carl Spiteri here to remind you to tackle retirement with a big smile and a whole lot of energy.
The content of this podcast is intended for informational purposes only. It does not constitute financial, legal, or professional advice. You should not rely solely on the information presented here to make any decisions. We recommend seeking the guidance of a qualified professional for any specific situation. Arc Latex Financial Services, LLC, NMLS number 2143, its hosts and guests cannot be held liable for any losses, damages, or other negative consequences arising from your use of the information presented in this podcast. For license information, visit www.nmlsconsumeraccess.org. Equal housing opportunity.